Hey, this is Carrie from Wrap Your Head Around Silks. You're listening to the Expecting Aerialist podcast. I'm so excited because the time is here. The comprehensive course by Wrap Your Head Around Silks is now open for 2021 registration for just a couple days. I am so excited for you guys to see what is in this course. It's basically my entire curriculum from A to Z on an online platform. Check the show notes, click there. You'll be able to see everything that's in it. I'm really excited to be your teacher. Check that out and I'll see you there. I'm so excited to have Dr. Angie Prescott here today. She is a physical therapist and aerialist from the DC metro area. And she also has a rare condition called Uternine Didelphys, which was new information to me. And basically, you grow two uteruses when you're in utero. And this happens before you're even born. She explains the condition to me and how she successfully had a baby. We also deep dive into reconnecting the barrel that is our abs and back and pelvic floor, and really talk about our own experiences of getting everything to reconnect and get our inversions back in our life after we have a baby. I'm so excited for you guys to hear this interview. Let's get started. Angie, so you are a mom, daughter or son?
Son. I have a 2-year-old. Actually, he turned 2 on Sunday, so a very recent 2-year-old named Kyler with a K. He's awesome. You know, like any mom will say about their kid. He's definitely the product of 2 parents in the health and fitness field. So, and I jokingly call him a circus kid because his father coaches circus full-time at the University of Maryland, and I have been involved in since I was a kid, and then I got into PT and rehab. So this poor child has been tested on every motor milestone and has been coached up everywhere.
You know, I'm in the fitness world too, but I never took to that side of it. Like, I have my CPT, but I just never cared to take a measurement ever of anything. And my daughter is going to turn 2 in 2 weeks. So they're very close.
Yeah. And so this has been just one ongoing curiosity experiment for me. I think I'm having as much fun watching him learn as he's learning. And that's been really cool as a PT because you go through physical therapy school and you go through kinesiology, which was my undergrad degree, and they teach you about all these like steps that kids take, motor milestones and development. And it seems very dry, but it's very cool when it's your kid. So
you are in the PT world. You have a PT private practice. You are an aerialist. Tell me about your aerial practice.
So I got into aerial in 2010, and I had been a competitive gymnast as a kid, and then I got into circus and acrobatics in college. So I've been doing gymnastics and something related to it for about 31 years now.
Oh my God, yeah. Yeah, you have.
So I, sort of reached the age of, I guess, like late 20s and had fallen off of training because competitive gymnastics and even recreational and performance gymnastics is hard if you are not a college student on a circus team like I was. And then when you graduate and get a full-time job, it becomes even more difficult. So I had somebody sort of haphazardly mention to me, "Oh, have you seen that thing where you hang from fabric in the air?" And I said, "Well, no, but 1, is it dangerous? And 2, does it look cool because I'm in?"
Yeah, I love it.
And I went and took a class, and it was very humbling and very overwhelming and frustrating. And within 20 minutes, I was like, I must sign up for a seminar or a series. I was hooked. So I got into, training just like everybody else 2-3 times a week around my full-time job. And I was still coaching that college circus team on the side, a team called Gymkhana at the University of Maryland. So I was really having a great time working in PT and then doing fitness and circus on the side. And then I got into some very basic sort of semi-professional performing. I did some shows, some art events in Baltimore. I did some performances in DC and loved it, and realized that there was a disconnect between aerials and PT, because the team that I coached, I served as their trainer, and I would send them off campus to regular medical professionals, and felt that they were getting cookie cutter diagnoses of, well, you're really strong and you're really flexible, so maybe just stop doing circus or gymnastics or aerials.
Yeah, like stop what you're doing and the problem will go away.
Right. Yeah, which that's, fantastic logic, because it will, but there's so many other problems that will ensue. Like, how do you give up something you love? And so when I actually got fed up with the PT company I used to work for in 2017, my husband said, well, why don't you open a practice and why don't you specialize in circus and aerials? So that's all I do now. I work probably 75, 80% of my clientele is aerialists. And then I do see some muggles, as we jokingly call them, and they enjoy being called. And I do aerials on the side. I had a little bit of a break in my aerial training, getting pregnant, having a son, and then pandemic kind of shut everything down here. But now we're back and up and running. So,
what is the aerial community like in that area?
It's great. There's a couple, aerial schools around the DC metro area. There's a place in Virginia called Monarcha. There's a TSNY DC that has everything from flying trapeze to aerials, and then a big school up in Baltimore called In the Dark Circus Arts. And everyone is just like I imagine everywhere, super friendly, all about every level. So beginner through intermediate through advanced and professional. And it's just this really close-knit community in the sense that everyone has met everyone in sort of the instructor realm, and they all work together. And I feel really lucky to live in DC because it's awesome.
You're in that area and you see a lot of aerialists. So how long have you had your practice?
I opened it a little over 4 years ago. So in June of 2017. And it's been more fun than I anticipated it would be. Obviously, there was a pandemic in the middle, so that made it challenging. But not only have I gotten to take some of the expertise I developed working as a coach and trainer for that college circus team, Gymkhana, for, I guess I've been with the program for 21 years, both as a student and a coach. I was able to take that knowledge and then extrapolate it to aerials, but I've been able to then learn more about common aerial injuries, common questions that don't have answers. And it's helped me connect with some of the circus aerial community, Emily Sherb, Jen Crane.
Yeah.
I've also gotten into treating pole athletes because there's a lot of overlapping injuries in the aerial and pole community. And it's awesome. It's a daily challenge, but it's something that's very interesting to me because we're asking so much of ourselves. Yeah.
So what's a common injury? What do you see? And then what have you seen that's like, whoa?
So I'd say that probably the two most common realms of injury I see are scapular dysfunction. So people with shoulder and rotator cuff problems related to aerials that ironically are more because of their desk job and then taking up aerials.
Okay.
So actually, I jokingly tell them that aerials is the diagnostic tool that points out the problem they already had, which is cool. And then I see a lot of lower core and low back dysfunction.
Okay.
Again, probably more because we spend a large number of hours in our day sitting. And they're common. So the neat thing about it is aerials will bring attention to this. It kind of shines that giant spotlight on areas that are not strong. Mm-hmm. And then crazy things that I've seen from, aerial injuries. Obviously, falls are always the scary part when somebody hits the ground, but that's pretty rare. Generally, I see a lot of overuse injuries in the hand that you normally wouldn't see in the average population. So dysfunction in muscles called the lumbricals between the bones of the fingers. You see some dysfunction in the thumb that's not very common. It's more similar to something called Nintendo thumb that you would see in gamers, but they're a lot more complicated and have challenged me because I was never a hand therapist. I was a general PT. So really found them to be fascinating because they're pretty debilitating. You see people that can't do handstands all of a sudden or can't hang all of a sudden. So it's neat to fix that stuff.
Okay. And then have you treated a lot of women postpartum, prenatal?
I have actually, and it's becoming more common because I had a baby. I think it sort of allowed people to say, oh, Angie, that PT, she has a kid. You should ask her. So it's been a lot of fun because when I was first found out that I was pregnant, actually, I found out 2 days after I did an ambiance performance on Lyra and Fabric in DC for a big Mardi Gras party in January 2019. And it should have been my cue or clue that I was pregnant, is that I was so dizzy that I was taking basically an anti-nausea med to not get dizzy on the Lyra for these 10-minute sets. And so it was funny that my first indication I was pregnant was the fact that I couldn't handle spinning on an apparatus I'd done for a decade. Mm-hmm. So it's been neat getting a lot of postpartum. And I get a lot of women who are aerialists either pre-pregnancy or in like the first and second trimester, because they have questions about what do I do next? Because I don't want to be injuring myself long-term for this. And that's become more of a question I get asked. It was hard to answer originally because there's just not a lot out there.
Yeah, but more and more now.
Yeah, tons more. I mean, it's something that we're asking that women who are, in aerials and are either having kids, have had kids, or want kids, or are curious about, because it does represent potentially a break in our training, which we're happy to do, but we're like, well, what does that mean? So
yeah, what does that mean? What's the future of it? Yeah, what's gonna happen to my body in 2-3 years from now?
Right, and then what is it going to look like if I do this again and again? Kind of thing.
Absolutely. Okay, so let's go into your personal story, if you would honor us with as much as you want to tell us. So you had quite a roller coaster with your body.
I did. I had a crazy pregnancy, which actually was sort of built out because I'd struggled with pregnancy loss and not fertility issues, but difficulty conceiving beforehand. And I knew that was coming. When I was much younger, I was diagnosed with something called Uternine Didelphys, which is a fancy term for basically the uterus not fully dividing. So you kind of have one uterus that has, if anything, sort of a wall dividing it into two sides. And then it also left me with basically something called a vaginal septum. So if you imagine everything's divided in half. Externally, it looks normal, but internally, it's not. So it was a space issue, and then it was a timing issue. It's really hard to know which side of the uterus is the one that could become pregnant, and then how do you access that when there's an egg. So high rate of miscarriage, and then usually a pretty high rate of infertility. So I kind of had never imagined we'd successfully get pregnant and on our own, but we did. And then there was a high-risk pregnancy associated with it. So would there be enough space? Would the placenta hold? Because that septum is not standard tissue. So I got to go through this process of being a high-risk pregnancy and an athlete and trying to moderate the two without feeling like I was losing myself completely in the process and without putting Kyler at unnecessary risk relative to the doctor's concerns. So that was fascinating.
Okay, so go back, because I'm having a hard time understanding this uterus thing. So how rare is that actually?
So there are a couple studies that suggest it's like as common as 1 in 10,000 or as rare as 1 in 100,000. And there's multiple variations of this. So there's not just my anatomical abnormality, there's multiple versions of it. But it occurs because when we are in utero growing, as our cells divide to create the reproductive tract, there is an incomplete dividing of these cells. And so instead of splitting into two and becoming sort of separate organs, this septum of basically cellular split stays. And so you just have basically two sides of something. It's one organ that is just divided by almost a wall.
And does this happen for other organs?
It can, yeah.
Okay.
Or it can extend up into the urinary tract or other areas, especially it's more common to have other abnormalities if it's a more severe malformation, but there's all kinds of degrees. What's cool is in the past couple of years, more and more women have talked about it online, because when I was first diagnosed, I was in college, and it was one of those very few things that the health center actually got right. So that's pretty fun, because the University Health Center where I went to school was known for misdiagnosing everything.
If you don't mind me asking, how old were you when you started your process of trying to have a kid?
Halfway through 35, almost 36.
Okay.
So it took us a while. But I recognize there's women who struggle many more years. So I would consider it, reasonable time frame for me. We did have one distinct miscarriage in there that was a little bit farther along than I would want it to have gone. But we survived it and learned from it and made Kyler all that much more exciting. So it did give me sort of a new perspective on what a lot of people go through in that realm. And I thought that was the most common occurrence in women, and realizing now that that's 25 to 30% of us.
Yeah, the fact that I got pregnant just naturally having sex and she came out wonderful. I did not have a good realization of how lucky I was until I'm doing all these interviews.
Well, and it's great because I feel like it's our generation is talking about this. Women who are currently young moms or becoming moms or are sharing this experience, which takes a lot of it out of sort of the darkness and makes women recognize that it's a part of the process and not something they need to hold back or be afraid of. And it's not something that, if you look back 20, 30 years in even sort of general healthcare assessment, it was sort of women have to be extra careful to prevent it, as if it was something we had some voluntary control level over, which is fascinating.
Okay, so you had this thing that you knew about, and then you guys just tried after you had the loss, and then you guys got pregnant.
Yeah, it took us a few months. We got pregnant. Actually, ironically, we got pregnant at the exact time we were filling out paperwork and figuring out a surrogacy situation with my best friend who had volunteered to rent out her uterus to us.
Wow, that is a good friend.
I know, right? Now that I've gone through pregnancy, I have asked her many times, were you crazy? But she's, we've known each other since kids. So as soon as we had started to secure that as a direction, because there's a lot of legal paperwork, even with somebody you know about, that was when we got pregnant. And I kind of jokingly say, well, we had stopped caring as much. We weren't stressing. We were just not freaking out, and it worked. So that was my big joke is, when I was no longer worried about it, it worked out.
Yeah, that seems to happen for a lot of people. Okay, so you're in your, when did you learn that you're pregnant?
I was really pretty lucky. It was early on. I was about just under 6 weeks pregnant, and everything kind of, progressed pretty standard from there. They did send me to an high-risk OBGYN, and I had to do a few more monitoring and tests early in the process and then throughout the process to make sure everything was developing okay with Kyler. And so I was really fascinated early in the first couple of weeks as to what I could do, knowing from a PT perspective how prevalent DR was and how prevalent pelvic floor dysfunction is postpartum. I'm a short 5'2", so I'm a tiny little frame, and any concerns, I had over that, how could I assuage them by looking into the literature, and really took a conservative stance on preventing abdominal issues during pregnancy by reading some of the most aggressive anatomy and biomechanical analysis of the abdominals in Aerial that I could find, and then doing sort of my own research and talking to other people. And I got concerned about basically the 12 to 14 week range where the fetus is moving up above the pubic bone and your abdominals are now getting the cue to basically not stretch, but that transversus, that deep abdominal muscle is being cued to not contract as fully. And your rectus will always try to contract when you invert. So that's where I started to wonder, are we at a point now where I'm going to be pulling on that linea alba and creating more of a separation or putting myself at risk? So I actually took a pretty conservative step and stopped inverting at the 13-week mark.
Okay.
Intentionally, just to see what would happen with it. Because, there's so much literature out there that suggests that diastasis recti it's prevalent in 27 to 100% of pregnancies during the second and third trimester, which to me is a crazy range. It just indicates that literature doesn't really know how this factors in. We know it happens, but it would indicate to me that as a PT, maybe this is really occurring in all of us. And the more relevant area is what happens after. How do we minimize the postpartum sort of inhibition of these abdominals to get that separation back quickly? So I was, thinking I'll take this very conservative step and prevent any damage, prevent any injury, and then I'll do all these very safe exercises. So very safe core exercises that don't involve shortening the abdomen, that don't involve rounding the back, and see if I could prevent it, which did not go according to plan. So further proof that this may not be something that's entirely environmental or even environmentally controlled, that it may be more genetic. And it actually, when I was going through PT school, I was told it's really more common in women who are overweight or obese and sedentary, which would not describe my life. So I thought I was in the clear. So I kind of, as a PT, thought I had this inside knowledge that was going to keep me safe. And sure enough, we had to have a planned C-section because all of the abnormalities to keep Kyler safe. So I knew going into this pregnancy that I was going to have a C-section, which every aerialist wants to avoid, I think.
Yeah.
And then I, was like, okay, well, I'll have a C-section, but I'll be okay. And then I remember in the C-section, actually, my OBGYN said, wow, you've got great abdominals. You'll heal fine. And about 6 or 7 weeks postpartum, I started to notice the separation. And then even more alarming, I noticed an umbilical hernia as I lost some of the pregnancy weight. And I'm sitting there thinking, oh my gosh, how in the world did I finish all of this, taking all these precautions and doing all the safe strengthening and all the recommended activities and end up with an umbilical hernia, a DR, and some adhesions from the C-section that I tried to avoid. So it was interesting.
Okay. So I need to know about all of that more. But then the question I want to ask before we move on from the actual birth is, what did your uterus look like in the ultrasounds? Is the baby in one half of your uterus the whole time?
The whole time. So imagine basically if you take a uterus and divide it in half, so basically vertically from top to bottom. One side on me, it's my left, is 2/3 of the size of like a regular uterus, and the other side is 1/3. So that's how the division occurred. So he was on my left, which is the larger side. So basically my pregnancy moved more to the left side than the right. From the front, it looked pretty standard, but it did mean he ran out of room earlier in the pregnancy. So he actually was breech and couldn't flip because he was running on very, very small rented space. He lived in the true prenatal tiny house. So,
and then the placenta ended up where?
It's only on the one side. So it's just on the side that it has access to. So that 2/3 left side. Theoretically, the right side would have had a uterine lining, but no placenta because there was no baby there.
Okay. And it's completely like sealed off. So the other side is just empty.
Yep. Ironically, it does not this way with everyone that has uterine didelphys, but I have 2 cervixes, which I did check. The plural on that is cervices, which I don't know why.
How does that work?
Right. I know. It's crazy. This was a sort of like lifelong discovery process. So because of the way the abnormality developed when I was in utero, my body didn't merge all those cells into one. So they just developed independently of each other because of the septum that runs through the uterus down into the vaginal canal.
Okay.
So I actually have to have 2 pap smears. And as a competitive gymnast as a child, I would try to use tampons, but at that point I could only find one side of the canal. So I assumed that I was doing it right, but I actually need 2. And this is pretty common in women that have a septum or uterine didelphys. So much to my dismay, I had healthcare providers asking questions like, are you using the tampon wrong? Which even as a 17-year-old, I felt that was not a medically relevant concern.
So, okay, let me just get real basic with this because I'm trying to imagine this. So if you bring your fingers up your vaginal canal, there are 2 cervixes that are like, you could feel them.
One's harder to get to because the size difference, that 2/3 and 1/3. But yeah, basically my OBGYN would have to theoretically look and could find 2.
And for example, I just started my period today. I use a Diva cup. So you can't really do that because...
I can't do that because there's no way to put 2 of them in and have them line up. So it's basically tampons or pads, and it's tampons, not tampon, which, when I was younger, it was one of these, embarrassing problems. Like, what do I do with this? Once I figured it out, if you were, say, at an event where you didn't have a tampon and you're like asking someone for 2 and they look at you like, are you not going home later? What do you need to do? So, I just kind of like, it always come up a reason. Could I just have 2, in case? And they'd look at me, not funny, but pull out 2 and hand them to you, kind of wondering why you'd ask. But it's because without 2, one side is still basically leaking. It does make for, I was actually told at a younger age I might have polycystic ovarian syndrome or PMDD, those 2 disorders with really heavy periods.
Okay.
Because nobody identified that what I was effectively like shedding every month was a uterus and a quarter or uterus and a half, because that septum in the middle also has a uterine lining. So it's like taking one room and making it into 2. So it would be a really heavy period, and there is a chance that they would be slightly off and have like a day or 2.
Oh my God. So you potentially have like 2 periods?
Yeah. So they'll always be around the same time, but they could be like, one would be like your first day might be on Tuesday for one side and like Wednesday morning for the other side.
Oh my God, Angie, my mind is fucking blown.
Yeah. What's really crazy is some women with this condition actually there have been cases of 2 pregnancies that occurred at different times. So think about that for a second. So there are cases of women who got pregnant, say, in March and then got pregnant again in May. So they have 2 concurrent pregnancies that are not the same delivery day.
What?
Yeah, it's happened. So that's actually something that has occurred in some women. So
and then they have both babies? They're in a first trimester and then a second trimester with the other one?
So they basically have both babies. Usually the second pregnancy is cut a little short. But they had kids to term.
Shit. I feel like for this damn podcast, I'm going to college again. The amount of things that I am learning every single week is blowing my fucking mind, and I don't even know what to say. So, okay. I don't want to act like I know what I'm talking about. So if you use like a super tampon, you could technically just like block the entire entry, and that would do it.
Nope, I still have to use 2 because the septum goes all the way down right to the end of the vaginal canal. It stops internally, but it would only work one side.
Oh, so that membrane actually goes down pretty far. And so how are you having sex comfortably?
It's just lucky for me that one side is 2/3 of the other. Like it's not like it's divided in exact half. So my body was moderately asymmetrical, which has worked in my favor my whole life. So it actually left me with no real concerns. Like beyond, basic, like lack of space in some cases. But
I'm sitting here with my mouth open.
Yeah, there's some people that have a lot of trouble with it, actually. It's one of those diagnoses that because, women in pelvic pain are notoriously undertreated.
Yeah.
People can go, decades without figuring out what's wrong with them. And it's because they may be divided more, symmetrically in half, for example.
Okay, so let me know if I'm getting too graphic with my questions.
Sure.
So when you guys have sex, does it just go in the right place because that's where is the bigger opening?
Yeah, exactly. I had 3 OBGYNs before the one that diagnosed me miss it entirely.
Okay. So it's not like okay, I gotta go right or left.
No, you kind of have to look for if you want to. Like it looks like you're going straight, you're really going left. So if you wanted to go right, you'd have to really like make an effort to find right. So I can only find the right side because I know it's there now.
Okay.
But I had so many OBGYNs who, when you start, going through high school and college and you want to get birth control, back in the 90s and 2000s, you had to actually go to an OBGYN to get it. And they would want to do an exam and they totally missed it. I think my first exam was when I was 16 and I didn't get a diagnosis until 23. So for 7 years in there, I had questions that nobody could answer and no OBGYN found it.
Oh my God, that's frustrating. So you're leaking all over the place for years and years and years.
Yeah, and I'm a high-level competitive gymnast going to gymnastics meets and just praying to goodness that none of them timed out with my cycle.
Oh my God, this is so tragic as a 12, 13, 14, 15-year-old. Oh my God.
Yep, it was kind of crazy. So I just assumed, and, like all 13, 14, 15-year-olds, you just assume you're doing it wrong. I had some friends that I was like trying to casually slip into conversation. So how do you use a tampon? And they'd be like, well, you just insert it. And I was like, so does it go sideways or is there a specific angle? Like I was like literally thinking geometry, like maybe I'm reading this manual and it says it has to go up and back. Is it like 35 degrees back or 30? I thought that I was doing it like wrong by a measurement of degrees. It was looking back, pretty hilarious that I couldn't quite figure out what was happening, but I would have had no idea and nobody else, helped. So they kind of just said, well, maybe tampons won't work for you. And I was like, is that a thing? Okay.
Oh my goodness. How come somebody doesn't want a nap?
That sounds like my son.
Oh my goodness, Bean, this nap is like, she's shifting because like everyone else in the house is tired. This is what I don't understand.
Wait, that is the true story of parenting right there.
Yeah, like I could totally take a nap right now, and the Bean is just awake. So she's just sitting on my lap. Okay, Bean, can you just hang out? Okay, Angie, oh my God, never actually heard of this in my freaking life. And
well, if this is taking the podcast in a direction that you're like, this is too complicated. I want to do this.
No. It's like it's getting better and better. Like every week I do this, it's getting better and better because I'm like, oh my God, I've never heard of that. This is a real thing that people are, having to deal with in their life. And if other people don't know what it is, it's just you don't feel seen and heard if your doctors are like, I don't know what that is.
And there's a lot of doctors that don't know what it is. Actually, I've been to several since my diagnosis that I had to kind of update on the condition. It was even something that when I did go and speak with someone at a fertility clinic, they knew about slightly, but they wanted more diagnostics because the variability in the condition is so significant. So there's so many variations of this sort of malformation that even my fertility specialist was sort of in the dark. She had not worked with anyone with this condition prior.
Okay, and your surgeon who performed the C-section, how does it make it different for a C-section?
So thankfully, it doesn't change much for her from a standpoint of like what she's looking for, because everything is divided vertically from basically side to side. So coming from the front, what she did is she was just looking for the uterus that had basically had a baby in it. So it's very clear that one did and one didn't, so which was easy for her. It did make it more complicated from a standpoint of pain management, because when they do a C-section, and I did not know this, they induce you with Pitocin right before you go into the OR to make sure that during the cesarean, after they remove the baby, there are contractions to basically stop blood flow and prevent you from bleeding out. And they wanted to make sure they did that with me, because with the uterine abnormality, the risk of sort of emergency hysterectomy goes up dramatically, because they don't really know what they're going to find. And so it's possible that there's going to be some kind of damage or something that occurs that means you have to have a spontaneous hysterectomy. And they want to make sure that you're basically going to be contracting to prevent you from bleeding out. So when I went in for the C-section, they did the spinal and my legs got tingly and fell asleep, and they laid me down and I couldn't feel my feet and I couldn't move them. But because of the second uterus, there's a variability in nerve endings. So it's still one original uterus. It's now two halves. It kind of looks like a heart at the top, if that helps kind of give you a visual image. The spinal nerves that were numbed were not fully numbed. So I actually felt a large percentage of my C-section, which is not normal. Most people do not.
Oh, man. And
So-
wait,
And I didn't know that until after they opened me, because again, everything on the surface is normal. And it was more once they got into that uterine abnormality. So she was really good about it. She had seen one other pregnancy like this with a different version of my same Uterine Didelphys. And so having her there in the OR was awesome, because she talked me through it and basically said, okay, well, if you can feel that, it's a good thing you're an athlete. You're going to take a few deep breaths. And once we get Kyler out, we're going to get you some morphine. So let's do this. And she was very on point. So I was very lucky that I had sought out this highly specialized provider.
one more thing before we move on. Oh my God, my mind is blown. So if you were to start bleeding during that C-section, why would they ever have to do a hysterectomy?
So there's lots of reasons, and like that's where my knowledge base falls short. If you look at like an abnormality, they aren't really 100% sure like what connective tissue connects to the uterus in someone with an abnormality, which way the arteries run. So if they can't stop a bleed, then on occasion during C-sections they'll have to remove your uterus to prevent that artery that may have attached from it from basically bleeding out if they can't cauterize it or they can't prevent something. And in the case of abnormalities, you are basically going in blind, saying, I don't know if there are abnormal arteries. I don't know if there are abnormal veins. I don't know if there's anything in here that I don't expect. So because of an anatomical variation, the likelihood of more variations is higher, if that makes any sense.
Okay, this is just a theoretical question.
Mm-hmm.
But if you didn't have one of those uteruses, could you have the other one actually functioning by itself?
So some people would, but because mine is basically, so I technically have one uterus that was basically subdivided. So it's technically one. Each side has only one ovary because it's like left and right. So I don't have four ovaries. And some people will have literally two uteruses that have four ovaries. I have the top of mine is basically just sort of split into, instead of being like a bowl, it's like a heart shape with the septum down the center. So one can't exist without the other because they are the same. They just have basically like something splitting them, and somebody added a second entryway, if that kind of makes sense.
Okay.
So it's very bizarre. Now, there are some people that literally instead of forming a septum between the two, they split. And so they have entirely separate uteruses that then branch off like a Y-shaped vaginal canal versus one vertical canal with a septum down the middle. So there's all kinds of abnormalities. Some people just have what they call a bicornate uterus, where the top looks like a heart, but there's no septum, and it comes down to one cervix and one vaginal opening at the bottom. So it's really interesting. And because these are so rare, like all things in women's health, doctors have just said that this is one condition and they kind of lump us all together. But it's kind of like no two uterine didelphyses are the same. So there's a lot of variability.
Oh my God. Okay, I'm so happy, Angie, that you're on this, because otherwise I wouldn't have heard of it.
And I feel like it's something that I took a long time to recognize was not as isolating as it perceived it to be. And it's very fascinating for people who are otherwise struggling with fertility and other things to recognize that even with all these anatomical variations, I was able to conceive and carry a child to term healthily. So I think it gives people sort of a sense of like, whatever I'm dealing with, women have done amazing things and the body is awesome. So we'll get through this kind of thing.
Yeah, I agree. I think it's very inspirational as well, and eye-opening. And again, I never go into these things thinking, wow, I'm going to hear something I've never heard before, and it happens every single time. So, all right, let's go postpartum for you and your body. Yeah. So despite all of the intense research that you did and followed your own program, because you know so much, you ended up with DR and you ended up, so please tell me that discovery and then how it felt and then what it's like now.
So actually going into it, I went back for my 4 week or 6 week, I'm blanking on time. It all seemed so meshed in that fourth trimester there. My appointment to see my OBGYN, and I brought it to her attention because I was concerned about it. And even though she was a wonderful person and a high-risk OBGYN, she felt like it was, quote unquote, out of her wheelhouse. And she said, well, it's kind of early postpartum. I'm not worried about it. I don't really see much that's abnormal. How about we talk about it at the 3-month follow-up? And so that was my first sort of experience of, I'm a PT and I think this is here. I really want to look into it and see if I can get early treatment or come up with a better plan. But at that point,
you're talking about the DR and the umbilical hernia.
Yeah. So the umbilical hernia, she kind of just sort of not sloughed off, but she said, well, it's hard to tell right now. You're still so early postpartum. I did have some baby weight to lose. She kind of said, maybe it's an umbilical hernia. Maybe it's just a DR. But let's not panic. Let's focus on you being a new mom, which every new mom probably doesn't want to hear, because at that point I was like, well, no, my son's made it 6 weeks and you said at 8 weeks I can start working out again and I want to go back to training. So maybe we could talk about this. But I took a deep breath and said, okay, all things happen in time, be patient. And I said, well, what would I do if I was my own PT, right? So I would start doing at the 8-week mark some very gentle abdominal strengthening, pelvic floor engagement, transverse strengthening for the transversus abdominis. And that's what I started doing. And I said, okay, well, this is going to help, because every patient I've ever worked with that had a DR, this helps. And the more I, conditioned and the more I trained over the next, I guess it took me about another 8 to 12 weeks before I was able to kind of get back in and convince her to look at it with more detail. The more I noticed the umbilical hernia was very present. It was something that was extremely obvious to me, especially as the baby weight came off. And so finally, I guess it was at about the 6-month mark when I would have been going in for my normal follow-up. She referred me for a CT scan to have it diagnosed. And the CT scan showed at that point, they termed it mild to moderate DR and a mild to moderate umbilical hernia, which DR is improvable with exercise, but a hernia is not. That's kind of just there.
Okay. Can you please explain umbilical hernia and how you even knew when you saw it? Because I don't know what that looks like.
Yeah. So all of us are born, obviously, with an umbilical cord attached. And so that umbilical cord represents a hole in your abdominal wall at birth. When they tie off the cord over the course of your childhood, that hole then heals. So when you're a baby, your body is able to basically fill in and scar down the hole in your abdominals that was where your umbilical cord came through. And that sits around or below your belly button.
Okay.
And some people it can sit above. So on most of us would never notice it. Some kids, it'll linger, into early childhood, but it will still eventually flatten and heal itself because, I don't know, being a kid is amazing. Your body does things that it doesn't do when you're an adult. However, when you're an adult, that opening that was your umbilical cord, if your abdominals are taxed or stretched, can actually pop back open. Because it's not made of true abdominal muscle, it's actually a bit of scar tissue. It's an area of weakness relative to the surrounding structures. So there's not a ton of literature on development of hernias. Most research suggests that it's more common in people with weak abdominals and not strong abdominals, but that doesn't really mesh with my case. So I was a little bit puzzled. And then, how does this happen? The more I thought about it from a physiological perspective, the more it actually made sense to me. So if you have exceptionally strong abdominals and your body's cueing them to turn off, but you're an athlete and you know how to cue them back on, then wherever your body can make space for the pregnancy, it'll make space. Kyler was breech and his head had nowhere to go. I think his head just punctured right through what would have been that umbilical weak spot from me being a kid. And
oh, wow.
You see this little bulge. It looks like kind of the very early part of Alien when the alien's popping out of the guy's stomach and you see this little like bump that moves. The bump doesn't move, but every time you sit up or stand or pull your abdominals in, there's this little pop out. So it's kind of like a little like turkey timer that just sticks out.
So it's right above your belly button in the center?
Mm-hmm. Yep. It's almost exactly center. It can be off to the side in certain people slightly, but it's pretty close. Mine's slightly shifted left. But again, our belly button during pregnancy actually separates from some of the scar tissue underneath. During your first pregnancy, it's no longer exactly where it was because obviously the skin stretches, the fascia stretches, the abdominal stretch. And so when you see women postpartum, if you've looked at a lot of women, they have that very distinct, even if they're fit, I can tell you've had a like baby tummy where their belly button is not as deep, like the recess is not as distinct. And that's because some of those deep fascial layers are no longer attached. So mine sits right above my belly button. And then my belly button is actually more of a flat belly button. It used to be an innie. Now it's kind of just there. And so that's because it's not attached to anything because the hernia now has ruptured.
Got it.
That was pretty hard as an aerialist. I was like, what am I going to do with this? Because, if you read all the literature, even as a PT, having gone through multiple courses on postpartum health, it's sort of the accepted norm is that hernias are surgical issues. They don't fix on their own. And that was kind of upsetting to somebody whose entire career is basically saying, we can fix this.
So on you, is it something that you would ever get fixed surgically?
So as of now, no, which is pretty exciting to say 2 years postpartum, because it has taken me the full 2 years to get back to feeling like I have control over my core again. And that's, getting back to straight arm inverts and all the conditioning and training I want to do. And not feeling like I have this giant like alien bulge in my abdomen. But I imagine that it still means that it's a higher area of risk. So theoretically, a hernia becomes a surgical mandate, like you must do it if it ruptures to the point where your intestines or your like organs push through the hernia. So they push through the hole in the abdominals and then they sit outside your abs, which luckily for me, that hasn't happened. I've actually felt like I've been able to tighten it up a little bit by making the muscles on either side of that opening stronger.
I am going to start, I have an appointment next week with my primary and I'm going to get a PT. So I'm going to start that process anyway, because I thought I was good, but I plateaued and I've been on that plateau for a while now. Training, still plateaued. And also what sounds like from my end is that most lifelong gymnasts don't have the same problems that I have. And most gymnasts have different problems that maybe a dancer wouldn't have.
There's a lot of background in that.
Yeah. Me and Erica Lentz talked about this, how she, probably did 10,000 hours plus of pull-ups. And I did 10,000 hours of making my arm look a certain way in a movement, right?
Right.
For me, the strength stuff is so hard. And for you, maybe it's a different struggle. Is that a good assumption to make? Being a gymnast, that stuff is probably not as hard for you as it is for me. Anytime
you have a motor program that's been reinforced to that 10,000 hour, that level of expert, it comes back much faster. Which is why for me, this whole hernia thing was beyond frustrating because I've been able to do like a pullover, which is basically like you would pull over on a lyra or pull over on a trapeze on a bar since I was like 8. And so for the first 6 months postpartum, no matter how hard I trained, I couldn't pull over. And not only could I not pull over, my brain was basically confounded. I remember I went up to a bar and I hung from it and I went to like pull up and I couldn't do it. So then I said, well, let me jump up and over with my feet, the way we teach students and never really want them to do. And I couldn't even initiate the movement because my brain couldn't connect with my abdominals to initiate the motor program. It had no way of understanding what it was supposed to do now that there was this big hole vertically and horizontally in my abs. And then I jumped up on the bar from a block and said, well, let me roll forward. And if I roll forward, I should be able to, initiate the motor program in reverse. And all I could think in my head was, no, you're going to fall. Don't do that. And it was so humbling because you're right. Gymnasts, we just take for granted the fact that we can always do these strength moves. But because of this injury, my brain couldn't find my abs, which was really weird.
Okay. And so 1 year in, a year and a half, what are those steps of I'm starting to feel it better, but it's not 100%? Like, what does it feel like?
Most of it for me was basically being patient with it and reading about all the things that go into that pelvic floor PT, that whole barrel effect. So working with like taking courses on pelvic floor PT, not that I ever wanted to be a pelvic floor therapist, but it seemed exceptionally relevant postpartum. I should learn about it. Getting sort of the information of balancing the diaphragm with the pelvic floor, the abdominals with the back, and starting to look at imbalances in myself that maybe had pre-existed the pregnancy, but now I couldn't compensate for. And then taking that little bit of information and slowly working back to find balance between these sides of a barrel, the top and the bottom, the front and the back. And then going really slow. So taking exercises that I thought were too easy and making myself start from the beginning and work my way up, which was really hard as an aerialist anyway. And 6, 8, 12 months postpartum, I felt like I'd already overcome that weakness, but I hadn't. I had actually just skipped those steps. So despite my best efforts, I had to go back to square one and kind of start again, which was really weird and frustrating.
Well, I honestly feel like I might be at the same place because I basically trained inversions in a hammock like a beast because I was like, let's get these abs back, you know? Mm-hmm. And, you know, then I completely trained myself to the point where my hip went out of alignment, up and out, oof, superior and external because my psoas is a chunk. And I had to like spend the last couple weeks releasing that. So here's a question for somebody who is either somebody like me, other women who are trying to get back to the aerial practice, and there's no other big, you know, red flags. How would you talk about getting the pelvic floor and the abs to function well together? Because I don't think I figured that out yet.
It's hard because it's like so many things postpartum, your body feels different than it did before. But what you start to look for is, are you able to feel that connection where you feel like your core is solid, where you feel like you're able to go and initiate, a straight arm invert or lifting the legs toes to bar without your back becoming a factor. So for me, it was getting on the floor and being able to find my upper abs and lower abs and cue them to contract together and separately. And then I really got into studying engagement of my core with breathing. So the first exercise I brought myself back to doing was laying on my back, knees bent, head flat, taking a deep breath in. And as I was exhaling, trying to draw my belly button back to the floor while pulling my pelvic floor up in towards my belly button. So trying to basically raise the barrel bottom and compress the barrel front. And then I did that over and over. I'd set 3-4 minute timers and make myself work through it. Once that got easy, I did the same thing with my legs straightened out instead of bent, because that's going to put your hip flexor on a position of stretch to make sure that you're challenging your core a little more. And then I started incorporating things like a head lift in that position. And then I eventually got to a point where I could bring, so really small stuff, making sure that I was able to connect my abs top to bottom and side to side to a level of certainty where I could then basically move on and think of something else. So kind of, the way we teach students to break down a skill to the component parts before putting it back together, I was taking my abs and working with them in very small, isolated increments and being really honest with whether or not I could feel them working instead of skipping. So I had to break that habit of, well, I can lift my legs. That's good enough, right? Because it wasn't. I was lifting my legs with my psoas. I was lifting my legs with my upper core. I was using my lats, and I wasn't forcing my core to stabilize first.
Oh my God. This is me. 100%.
It makes me I feel better with that because I should know better. I've been a PT and in the field since 2004, and that didn't change the fact that I was like, well, I'm superhuman. I can just do it. And I actually set myself back by not giving myself the time and not really recognizing that pregnancy had done a number on me. I mean, it's basically it's kind of like gutting the inside of a building, and you have to rebuild it. You can't just assume that it knits itself back together. And that's, I think, the dilemma in women's health and healthcare is we take really great care of the mom while she's, pregnant. And then after we have the baby, it becomes all about the baby. And the mom is like assumed that it's all going to somehow magically get better. And what I've seen as a clinician, and obviously I was part of my own case study, is that I actually haven't met a single woman that just got better. I've met every woman I know that is at least in the aerial community or a gymnast or an athlete got through pregnancy, but something about themselves doesn't function the way it did before they had their child. And if they take the time and go back and see a PT, see a pelvic floor PT, or really like work with themselves and be honest about, coaching themselves through it, they actually find, I skipped a step. I need to go back. And that's really hard to admit, but I don't think healthcare tells us this. So I think we feel compelled to pretend like everything's fine.
Okay, I have a question. So if the exhale is you drawing your pelvic floor in and up and your belly down and in.
Yeah, so my cue, I actually use it as basically my exhale is I'm trying to press all the air out of my lungs by using my core to do so. So I had a pelvic floor PT that I'm friends with that I'd reached out to during all this process. And she had suggested I make a hissing sound when I exhale. So like a straight up like hiss. So as I'm exhaling, make a hissing noise and think of pressing the air out as I draw up and in through my pelvic floor and down and back through my abdominals. The key with it was don't let your back move. So hiss, but keep your spine still. And that was really the part that connected with me.
I meant not the exhale, but the inhale.
Oh, yeah. The inhale is basically let everything open. Yeah, let everything relax, kind of let it all hang out. Basically the come home at the end of the day, take off the tight pants and lose the bra moment was sort of her cue for me, was just let it all go.
Okay, but without moving your back.
Exactly.
Okay. I'm going to use this tonight. I'm going to see what happens. I don't have my hip kit. I don't have my inversion. Let's go get those back. And I did Pilates, but what you're talking about is not Pilates.
No, it's really basically...
It's laying on your back and doing breath work. That's what it is.
It really is. It's doing breath work. And that's what connected me with it. Because I could do Pilates. Like, the human body is so amazing. If you're not doing it right, it really doesn't care as long as you're doing it.
I could bring this into Pilates so very easily, but that's not what Pilates... It's out of our scope as a Pilates instructor.
It's definitely kind of out of the scope of, for me, as a very strong, like I'm a manual therapy orthopedic PT. It's almost hard to describe as a clinician to anybody. This is really us as individuals connecting with ourselves and trying to find that point, because as an instructor, like your skill set is so good that you can sort of work around this. Like you're able to train your abs effectively without even not even noticing, but without like honestly looking at the fact that they're not working the way you think they should.
Yeah. I mean, it's almost amazing that they can do so good without what they need.
And honestly, there's a couple of studies I've been looking into for DR, because it's fascinating to me how I think it's underreported, because in order for a pregnancy to be successful, we all have to have one during the third trimester to some extent. And then if, you and I, having been very well trained in core work beforehand, aren't able to get it to automatically kick in and fix itself, why would we think that regular, average, sort of non-super athlete women are somehow magically able to get their core to just turn back on without them trying? So I actually think that this might be a bigger problem as a sort of like postpartum issue that maybe aerialists notice more consistently, because we're so attuned to what we need our core to do.
Right. And we're asking our core to do some crazy stuff pretty early on.
Yeah.
Yeah. So how would another woman who's not trying to pull her own weight through her, and invert even realize that the functionality is not completely there? Because they don't really have a good testing system. We don't have a good testing system either, but I know if it's not working.
Right. Yeah. We're much more aware of something feeling off.
Yeah. So you're 2 years out and your hernia looks a little bit better and you're back doing your inverts and you feel very connected. That's great.
Yeah, it was hard to recognize that that's what was missing. It was a sense of like, oh, I can just basically go to invert and my body knows how to do this. It almost was like it was like driving home to your hometown, having not been there for 10 years, and just knowing how to get back to your house. It felt like subconsciously easy all of a sudden. And I was like, wait a minute, this has felt hard for years. What's going on? And it was just because I'd been able to reconnect.
Okay, Angie, you are speaking to my spirit animal right now, and this is the problem I've been having. Like, I've been talking about this, and I knew it was a disconnection, but now I'm going to, like, try this out on myself and maybe, like, give myself a little bit of a just like an emotional break from like, oh, this isn't working. And then just, ease into some stuff on the floor. And even laying in bed when I'm trying to get the bean to take a nap, I can do this anywhere.
Yeah, this I did a ton of with like Kyler was playing on the floor. It got more complicated as he proceeded to run everywhere and try to use all the stairs and electrical outlets. But I used like time with him on the ground to do this sort of cueing exercise. And then even without like the knowledge from like being a pelvic floor PT, which I don't have, I'm obviously a standard PT. I started doing this exact same motion in other positions. So could I do it on my back? Could I do it on my stomach? Could I do it in a sitting position? Could I try it on hands and knees? Could I do it standing? And then I started trying to do it hanging. So can I do this in a low hang on the fabric with my knees tucked to my chest, so sitting kind of in a ball on the floor? Can I do this in a position where I'm almost like in an electric chair hanging off the fabric with my knees and hips bent to 90? And then I started incorporating it into exits from skills. So I would invert any old way, and then I would basically do the descent with my knees very bent and very straddled, sort of in gymnastics we call it a cowboy. I jokingly tell my college athletes it looks like your feet are in the stirrups at a gynecologic, like an OBGYN visit. Trying to basically keep your knees as close to your sides as you can while still maintaining that lower core connection. So I started doing a lot of eccentrics, so a lot of lowering out of skills rather than worrying about can I get into them the right way. And over time, I felt myself getting stronger and stronger to the point where then I was able to initiate the invert, but I had to do it with bent knees. I had to do it with straddled legs. I couldn't do sort of the straight arm invert. I couldn't do the straight straddle invert. I had to do this sort of modified bent arm tucked position in a straddle. But I was able to connect with it and get my pelvis to roll all of a sudden. And then it started to come back in my hip keys, anything where I was doing that C-shaping or side bending. And it finally, I guess about, 3-4 months after I felt to connect with the lowering, that eccentric component, I was able to go back up and do the straight arm, straight leg straddle invert on fabric and actually feel my core almost reflexively kick in. Like it did what it was supposed to, and I didn't have to tell it. It was awesome.
Okay, so from when you decided to regress yourself to these floor cueing exercises to now, how long was that?
It took me about 5 months to get to the point where I started to feel the connection automatically. And it was about just under 6 before I was able to just tag into that straight arm, straight leg invert without even a thought process. It was pretty fast.
That is pretty fast.
Process. Yeah. Considering 2 years, 6 months, if you'd told me that like 2 years ago, I'd be like, that's so long. But now I'm like, no.
Yeah. And now, right. If I could have an ease in my straddles by like next spring, that's fantastic. Thanks so much to Dr. Angie for coming on the pod today. I learned so much from you. Oh my goodness. And if you're interested in checking out what's in the course, go to the link in the show notes and read all about it. Thanks so much to Asa Watkins for music and post-production. Ladies out there, if you have a story of your own, please reach out to me, Carrie at wrapyourheadaroundsilks.com. My goal is to reach all the corners of this world with your stories of motherhood, postpartum, and Ariel. And I don't know all of you, and I want to. So reach out to me if you're interested in being on the podcast. I'm really looking for diversity, geographic diversity, diversity in story, ethnic diversity, age diversity, everything. So please reach out to me and also leave a comment or a 5-star rating if you have time to honor me with that. All right, guys, thank you so much for being here. This is the Expecting Aerialist podcast. Okay, go ahead. Check. Mic, check. 1, 2, 1, 2. Hey, just talk.
Hi.
Say hi. You can tell me anything.
Yeah, I went to the corn.
Go ahead, keep on going. Tell me what you think.
Yeah, just a dream. We gonna the sun. Mama. Bye.
Bye. Are you done? All done?
Hello.
All done?
Hi.
Okay.
Check.
Okay. Check. 1, 2, 1, 2. Okay, say I'm all done.
Bye.
Bye.